Hello, let's talk about the basilar part of the skull. This is the basilar part of the skull external view, and this is the internal view of the basilar part. Okay, so the base of the skull, the external view, we will talk about its bones, its sutures and foramina. Okay, so the basilar part of the skull external view is divided into three parts. This one, which forms the heart palate, is the interior part. This part is middle part, which is made by a sphenoid, mainly sphenoid bone, and petrous part of temporal bone. And the third part is this posterior part, which is made by this occipital bone and mastoid process. Okay, so let's talk about the interior part of the base of the skull, external view or inferior view. Okay, so this heart palate is made by the two bones. The interior two-third, this bone is the maxilla, while the posterior interior two-third is maxilla, and interior one-third is the palatine, two palatine bones. Okay, so this is the maxilla, and this suture which connects, which is present between the two maxillary bone is called median palatine suture, or it is called intermaxillary suture. Okay, above this suture is this fossa or foramen. This is called incisive foramen or incisive fossa, and it transmit nerve and vessel. The nerve is nasopalatine nerve, while the artery is sphenopalatine artery. Okay, now this bone is palatine bone, and the terminal point of this palatine bone is this spine, which is called posterior nasal spine. Okay, the suture in between the maxilla and the palatine bone, it is called palato-maxillary suture. Okay, palato-maxillary suture, and this is in between the palatine and maxillary bone. This is greater palatine foramen, and this one, these two here, two are present. This is the lesser palatine foramina, and the greater palatine foramina transmits the greater palatine nerve and vessel. Okay, greater palatine nerve and palatine vessels. Okay, while the lesser palatine foramina transmit the lesser palatine nerve and its vessel. Okay, so this is the interior part, which is made by the heart palate. Now the middle part is made mainly by the sphenoidal bone. This is the sphenoidal bone, and this is the petrous part of temporal bone. Okay, so if we look into the middle or in the center of the middle part, this bone is called vomer. Okay, this is vomer, and the body of sphenoid bone, but here the body of sphenoid bone is not shown. These are two plates, one is medial and the other one is lateral. So this is lateral pterygoid plate of the sphenoid bone, and this is the medial plate of the pterygoid bone. In between the middle and lateral pterygoid bone plate, there is fossa. This is called pterygoid fossa. Okay, the medial pterygoid plate is also associated with this process, which is called pterygoid gemellus, and here in the inferior to the pterygoid fossa, there is scaphoid fossa. Okay, so this is the plates of the sphenoid bone. This is vomer, and the body of sphenoid is behind it and inferior to it, while this bone, this part of the sphenoid bone is called greater wing of sphenoid bone. Okay, And the greater wing of sphenoid bone has two foramina. This is foramen ovale, and this is foramen spinosum. Foramen ovale transmit the four structures. First is mandibular nerve, the other is accessory meningeal artery, third is lesser petrosal nerve, and the fourth is imagery vein. While the foramen spinosum transmit two structures, the one is middle meningeal artery and the second is nervus spinosus. Okay, so this is the two foramina, foramen ovale and foramen spinosum. While in the sphenoid bone, this is the scaphoid fossa, and behind the scaphoid fossa there is the groove for the eustachian tube or the auditory tube. So this is the groove for auditory tube. Okay, so this is the middle part of the base of the skull. This is the posterior part of the basilar, and it is mainly made by the occipital bone and the mastoid process. Okay, so the occipital bone has three parts. This is basilar part of the occipital bone. Okay, this is basilar part of the occipital bone. This is the condylar part of the occipital bone. This is the occipital condyle, one on each side, and this is the squamous part of the occipital bone. Okay, and this you can see, this is the mastoid process. Okay, this process is called styloid process. Okay, and this is the petrous part of the temporal bone. At the apex of the petrous part of the temporal bone, there is foramen which is called foramen lacerum, and it transmits the internal carotid artery. This is carotid canal. Okay, and this is jugular fossa, and its foramen which is jugular foramen. You can see this interior to the condylar process or occipital condyle, there is the foramen which is called hypoglossal canal, and this foramen behind the condylar process is condylar fossa. Okay, at the basilar part of the occipital bone, there is pharyngeal tubercle. Okay, this is the styloid process. Behind the styloid process, there is foramen which is stylomastoid foramen. Okay, and medial to the mastoid process, there is this notch which is called mastoid notch, and in the suture between the occipital bone and the temporal bone, there is foramen which is called mastoid foramen. Okay, and it transmits the artery and nerve. This stylomastoid foramen, it transmits the facial nerve and stylomastoid artery, which arises from the posterior auricular artery. Okay, also we mentioned about this mastoid notch, and the mastoid notch gives attachment to the posterior digastric muscles. Okay, so this is about, and this large foramina is called foramen magnum. It transmits the medulla, spinal cord, the vertebral arteries, the glossopharyngeal nerve, the nerves, the spinal accessory nerve. Okay, so this is the foramen magnum. Now going towards the basilar part, internal view. Okay, this is the internal view of the basilar part, and it is divided into three parts: interior cranial fossa, here to here, and this one is posterior cranial fossa, and the most posterior is posterior cranial fossa. So first, in the interior cranial fossa, we will identify some of the structures. So this is frontal bone. Okay, you can see this is the frontal bone, and this part is ethmoid bone. Okay, so the frontal bone and ethmoid bone made the anterior cranial fossa, and you can see this is the sphenoidal bone. some part of the sphenoidal bone contribute in the formation of interior cranial fossa. Okay, you can see this ethmoidal bone has pores. So this is the cribriform plate. Okay, cribriform plate, and the cribriform plate transmit the olfactory nerves. Okay, this foramen is called foramen cecum, and the foramen cecum transmit the imaginary vein between the superior sagittal sinus and the nasal veins. Okay, so and the cribriform plate has also interior ethmoidal canal and posterior ethmoidal canal or foramina, which transmit ethmoidal nerve and vessels. Okay, so this is about the ethmoidal bone and the frontal bone and the some part of the sphenoidal bone which forms the this interior cranial fossa. You can also see this part of the bone which is part of the sphenoidal bone, and it is called lesser wing of the sphenoid. This is greater wing of sphenoid, okay, and this is lesser wing of the sphenoid. So lesser wing of the sphenoidal bone makes the contribution to the interior cranial fossa. Okay, now coming to the middle cranial fossa. This is all the middle cranial fossa, and it is its main characteristic are sella turcica. Okay, so this part of the basilar part of the bone is called sella turcica. You can see it, and the sella turcica has three parts. Okay, this fossa is called hypophyseal fossa. Interior to hypophyseal fossa is tuberculum sella. This is tuberculum sella, this is hypophyseal fossa, and posterior to hypophyseal fossa is dorsum sella. Okay, so this is the sella turcica. Now this is I mentioned that this is the lesser wing of the sphenoid which contribute to the interior cranial fossa, and this is the greater wing of sphenoid which contribute to middle cranial fossa. In between the lesser wing and the greater wing of the sphenoid, there is this fissure, this one. This is called superior orbital fissure. Okay, this is called superior orbital fissure. You can see this is superior orbital fissure in between the lesser wing of the sphenoid and greater wing of the sphenoid. Also, the greater wing of sphenoid bone is three foramina. Okay, this is the greater wing of the sphenoid bone. The first foramina is the foramen rotundum. This second foramina is foramen ovale, and this is foramen spinosum. Okay, foramen rotundum transmit the maxillary nerve V2 of the trigeminal nerve, second division. Foramen ovale transmit the four structures. The mandibular nerve, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and it also transmit the accessory meningeal imaginary veins. Okay, so it also transmit the imaginary veins, while the foramen spinosum transmit middle meningeal artery and vein and meningeal branch of mandibular nerve, which is also called the nervus spinosus. Okay, this is also called nervus spinosus. Okay, so these are the foramen in the sphenoidal bone. This foramen which is interior to the petrous part of the temporal bone, this foramen is called foramen lacerum. Okay, this is foramen lacerum. Okay, so this is the middle cranial fossa. Okay, middle cranial fossa. Now going to the middle cranial fossa also has contribution from the petrous part of the temporal bone. Okay, this is the squamous part of the temporal bone, and this is the petrous part of the temporal bone. Okay, so this is the temporal bone. You can see the foramina in the temporal bone. In the temporal bone, this foramina is internal acoustic meatus. This one is jugular foramen. Okay, and this is foramen lacerum. Okay, and this is carotid canal. Okay, so this is the about the temporal bone. Now the posterior cranial fossa. Posterior cranial mainly is formed by the occipital part of the occipital bone and the mastoid process. Okay, the occipital bone has interior part interior to the jugular foramen. This is the basilar part of the temporal bone. Okay, basilar part. This is the squamous part of the temporal bone, occipital bone behind the this foramen magnum. Okay, and this is the condylar part of the occipital bone. Okay, so you can see the sphenoidal bone and this occipital bone has a suture, and this part of the posterior cranial fossa, it is called clivus, which transmit the basilar artery. Okay, so this is the clivus, and the occipital bone, this is occipital internal occipital protrusions, and the line from here, this is internal occipital crest. Okay, so this is the about the internal part of the basilar part of the temporal bone. Okay, so you can also see there is hypoglossal canal in here, or hypoglossal foramen in the occipital bone. Now we will look into the foramina and its contents. This is the external part of the basilar part of the bone. You can see this is the hard pellet. The superior part has incisive fossa or incisive foramina, and it transmits nasopalatine nerve and spinopalatine artery. Okay, spinopalatine artery. This is the greater palatine foramen, which transmits greater palatine nerve and artery. This is lesser palatine foramina, lesser and it transmits lesser palatine nerve and artery. You can see above interior to the this petrous part of the temporal bone is the foramen lacerum, and it transmits the internal carotid artery. There is foramen ovale in the greater wing of the sphenoid bone, which transmit the lesser petrosal nerve, mandibular nerve, and accessory meningeal artery. Okay, this is the foramen spinosum, which transmit middle meningeal artery and meningeal branch of the mandibular nerve, which is also called nervus spinosus. Okay, this foramen, this canal, which goes in the petrous part of the temporal bone up to the foramen lacerum, and it is the carotid canal. And in the carotid canal, there is internal carotid artery along with internal carotid plexus. Okay, now this is internal stylomastoid foramen, which transmit facial nerve. Okay, now this is hypoglossal canal. You can see it. Hypoglossal canal transmit hypoglossal nerve. This is foramen magnum, which transmit the medulla oblongata, spinal root of accessory nerve, and vertebral artery. Okay, so these are the important foramen. Now if we look into the foramina of the internal part of the basilar part of the bone skull, there is foramen cecum. This one is foramen cecum, and foramen cecum transmits imagery vein to the superior sagittal sinus and nasal veins. Okay, this is the interior ethmoidal canal, and this is the posterior ethmoidal canal. Posterior ethmoidal canal transmit posterior ethmoidal nerve and artery, while the interior ethmoidal foramen transmit or foramen or canal transmit the interior ethmoidal nerve and artery. Okay, this canal is optic canal. Okay, and optic canal transmit optic nerve and ophthalmic artery. This is the superior orbital fissure, and in superior orbital fissure there is transmission of oculomotor nerve, trochlear nerve, ophthalmic nerve, first division of the trigeminal nerve, abducens nerve. Okay, and superior ophthalmic vein. This is foramen rotundum in the greater wing of the sphenoid bone, and it transmits maxillary nerve. This is foramen ovale, which transmit mandibular nerve, accessory meningeal artery, and lesser petrosal nerve. This is foramen spinosum. All of the these three foramina is present or located in the greater wing of sphenoid bone. Foramen spinosum transmit middle meningeal artery and meningeal branch of mandibular nerve. Okay, this is foramen lacerum, which transmit the internal carotid artery. This one is carotid canal. Okay, carotid canal transmit internal carotid artery and internal carotid plexus. Okay, this is hiatus for lesser petrosal nerve. This is hiatus for greater petrosal nerve. This one is internal acoustic meatus. Okay, we transmit two nerves. Okay, and one artery. The nerve are facial nerve and vestibulocochlear nerve, while the artery is labyrinthine artery. This one is mastoid foramen, which transmit mastoid imagery vein. This one medial to the petrous part of the temporal bone is jugular foramen. Okay, jugular foramen transmit the glossopharyngeal nerve, vagus nerve, spinal accessory nerve, sigmoid sinus, inferior petrosal spinous, and posterior meningeal artery. Okay, this one. Okay, this posterior to the jugular foramen is condylar canal. Okay, this transmit the condylar imagery vein, meningeal branch of ascending pharyngeal artery, while this one in the condylar part of the occipital bone is the hypoglossal canal, which transmit hypoglossal nerve. Okay, and this large foramina is foramen magnum, which transmit medulla oblongata, vertebral artery, meningeal branch of vertebral artery, and spinal roots of accessory nerve. Okay, so this is about the basilar part of the temporal bone.